and thank you for joining us. Today, Bermuda laid to rest a Bermudian public servant, a Bermudian leader, and our friend, former Speaker of the House and MP for Southampton East, Stanley Lowe. In a pre-COVID-19 world, he and his family would have received the pomp and circumstance of an official funeral, and the line of speakers to give him the recognition and accolades which he deserved would have covered the gamut of past and present political, social, and community leadership. Sadly, with COVID-19 and physical distancing, we could not give him the homegoing ceremony that a man of his accomplishment and stature deserved. We who serve in the House of Assembly meet on Friday, and I'm certain that the outpouring of admiration, respect, and stories of Speaker Lowe will provide some comfort until the day when we can properly and fully recognize this fallen Bermudian. Our prayers are with his family and with all who knew, loved, and admired Speaker Lowe. I'm pleased today to have with me the Minister of Health, Kim Wilson, the Minister of Public Works, Lieutenant Colonel David Birch, the Minister of National Security, Wayne Keynes, and Bermudian biochemist and science advisor to the government of Bermuda, Dr. Karika Weldon. The first speaker today will be Minister Wilson, who will give an update on COVID-19 testing results and the work being conducted by the Ministry of Health. Minister.
Thank you, Premier. Good afternoon. Today, there were 195 test results received by the Ministry of Health, and 3 were positive for COVID-19. Bermuda now has 118 confirmed positive cases, and their status is as follows. There are 52 active cases, of which 37 persons are under active public health monitoring and 15 persons are hospitalized. A total of 59 persons have now fully recovered, and the total deceased remains at 7. The average age of all of our confirmed positive cases is 60 years age, and of all the positive cases is from the ages of 18 to 100 years. That is the age range. And the age of persons hospitalized ranges between 64 and 91 years, and the average age of that is 77. As of today, we have tested 247 care home residents and 302 staff members from 12 different care facilities. Of all those tested, 505 results have come back negative, with 44 positive, and we plan to finish the testing of all of our care homes by Sunday. I would now like to clarify how cases and countries are classified, as the terms sometimes overlap and sometimes do cause confusion for members of the public. Cases can be classified as follows: either imported, local transmission, or under investigation. An imported case is a person who was exposed to COVID-19 whilst abroad. A case is classified as local transmission if the person has no history of travel or has a known exposure to an imported or a confirmed case in Bermuda. A case is considered under investigation until an exposure to COVID-19 of that individual has been determined, and at which point it will be classified as either imported or local transmission as appropriate. If no link is found within 4 weeks of a positive result, the individual case will be classified as, quote, local transmission. We are not classifying individual cases as, quote, community transmission so as to avoid confusion with community transmission on the country level. Community transmission is a country classification which is defined by the World Health Organization as larger outbreaks of local transmissions defined through an assessment of factors including but not limited to large number of cases not linkable to transmission chains, and or multiple unrelated clusters in several areas of the country. Other categories included by the World Health Organization are sporadic cases and clusters of cases. Bermuda is currently classified as clusters of cases, which is a category for countries with local transmission. We will advise immediately if our country's status changes. Over the past few weeks, the Ministry of Health has created various guidance documents regarding face masks, from how to make them to how to wear them. And as I've said previously, I've seen some very impressive homemade cloth masks over the past few days. Today, I want to clarify when to wear a mask. The short answer is that you should wear a mask whenever you are outside of your home. This includes at the grocery store, while taking public transport or taxis, or for workers at all workplaces, unless, of course, you're working from home. There are exceptions to this guidance. You can remove your mask while engaging in strenuous exercise outdoors, such as running and jogging, but you must put it back on once you have completed your exercise if you plan to be around others outside of your home. Delivery personnel must wear a face mask when going on about their business in accordance with the current regulations. And lastly, mask wearing is not recommended for young children below the age of 2 for child safety reasons. I want to remind the public that because there is currently a global shortage of surgical masks, Bermuda needs to conserve these masks for those who need them the most, such as our healthcare workers or for those individuals who are sick. Reusable cloth masks complement safe physical distancing measures as well as provide some basic protection. Masks help to protect others from you in case you are infected but unaware. And remember, as I've said previously, I wear a mask to protect you, and you wear a mask to protect me. For more information on wearing a mask or making one, go to coronavirus.gov.bm. Now that the shelter-in-place restrictions have ended, we are in phase 1 of reopening. Business leaders must do all in their power, as well as exercise due diligence to ensure that their employees are adequately protected when returning to work. In light of this, return-to-work guidance for businesses has been created with recommendations to assist employers in establishing workplace protocols to protect employee health and safety when returning to work after COVID-19. It includes sections on infection prevention and control measures, return-to-work considerations, occupational risk assessments, site cleaning and disinfection protocols, site operations, and risk management, as well as general information on COVID-19. It also provides a sample screening questionnaire for employees returning to work after the shelter-in-place and an occupational safety and health risk assessment template. Additionally, it contains information for specific populations and work groups. For example, there's industry-specific guidance for healthcare professionals, care homes, offices and banking services, construction, mechanical and landscaping, warehouses, auto dealers, and retail operations. We recommend that screening protocols also be in place before employees return to work. Employee screening will help ensure that any symptomatic individuals are identified before coming to the facility and to prevent the potential spread of infection. In addition to employee screening, once employees arrive to work, it is advisable that clear reporting procedures be developed and communicated to all members of staff. These procedures must inform staff of what to do if they were to develop respiratory symptoms. Conducting an assessment of employee occupational risk of exposure to COVID-19 will be crucial in determining what steps are needed upon reopening your business. Occupational risk will vary from very high, medium, or lower risk. The level of risk will depend on several factors, including the industry type and job responsibilities, the need for close contact with persons who are known or suspected to have been infected with COVID-19, the need for close contact with the general public, the need for repeated or extended contact with the general public, and employee susceptibility to infectious diseases. It is essential to determine which occupational risk category your employees fall into. In doing so, you must consider that different groups of employees may be exposed to different risk levels. You must also take into consideration whether or not you have any medically vulnerable employees in your workplace, and this information will determine the types of controls that may be needed to be exercised within your workplace. Once your business reopens, it is essential that protocols are in place to outline what employees must do if they develop any respiratory or flu-like symptoms when at work. These protocols must outline as a minimal who employees must report to, what information is reported, and who maintains this information. And we would recommend that the person or persons in charge of maintaining accidents or dangerous occurrence reports at your place of employment or other occupational safety and healthy issues at your business should be responsible for this exercise. We also recommend that a specific location be designated for employees to develop respiratory or flu-like symptoms while at work to ensure that they are adequately isolated from the rest of the workplace. This location must be communicated to all employees so that they can report to this area as needed. All areas where these employees have must be cordoned off as appropriately and cleaned and disinfected. Before employees return to work, we recommend that thorough cleaning and disinfection of the work facility be conducted. Disinfection should focus on frequently touched and flat surfaces throughout the facility and must be done multiple times daily with EPA-approved disinfectants or a bleach solution only. Again, that guidance can be found at our website at coronavirus.gov.bm. In closing, I just want to highlight the availability of our emotional well-being hotline, and that's 534-11, let me say that again, 534-1111, and that's a resource to all of our community while we weather this storm. Again, that number is 534-1111. We realize that these are times of extreme heightened stress and anxiety, particularly for those who are in quarantine and those being tested for COVID-19. And therefore, I want to remind people that this resource does exist for you. Thank you to those individuals who man the phone lines at the Wellbeing Hotline, providing this vital service to our community. And finally, I would like to thank another group of people trying to help out those who may also be struggling. Thank you to the Marketplace, who have announced today that they will be offering a 5% discount to all financial assistance clients from now until the 31st of October. This applies to all of their Marketplace and Price Right stores at any day of the week. So thank you to all of our community partners who are helping us as a government and as a community weather this storm called COVID-19. Thank you, Premier.
Thank you very much, Minister of Health. Following on from the Minister of Health, we have with us Dr. Karika Weldon, a young Bermudian woman of international acclaim who we are truly fortunate to have with us on island, aiding us in the fight against COVID-19. I first met Dr. Weldon 3.5 years ago when she came back to Bermuda to speak at ThinkFest hosted by Io Johnson. Since that time, I have been incredibly impressed with her dedication to promoting science in Bermuda. She has started a foundation in Bermuda to raise money to expose young residents to science. She has mentored many students here, and she's hosted international conferences in Bermuda to discuss cutting-edge topics in genetics, such as gene splicing. She is a member of the Royal Society of Biologists and recently became a fellow of the Institute of Biomedical Science. Dr. Weldon gave this presentation to our cabinet yesterday, and I thought it would be great to share with the country so that all can have a better understanding how testing assists in defeating COVID-19. She will be discussing the work that she's doing in conjunction with the Ministry of Health to keep Bermuda in a global leadership position containing this particular pandemic. Now, I give warning before Dr. Weldon starts that some of the items of which she covers are particularly technical, and I know that there are slides to accompany this, and I apologize that there might be some interruption of our services for the hearing impaired, but we are going to make sure that this video is put out later so that those persons who are hearing impaired can make sure they can get the full information that Dr. Weldon is putting forward. With that, Dr. Weldon.
Thank you, Mr. Premier. I'm pleased today to share with you all a detailed situation report today on the status of Bermuda's COVID-19 testing. There are 3 different types of COVID-19 tests that are recommended by the WHO. First, you have the RT-qPCR test, which is what we're currently using in both labs to diagnose if people have the infection or not. You also have the serological test, and then you have viral genome sequencing, and I will touch on those in a bit. Since the middle of March, Bermuda has been in a position to conduct on-island testing using the RT-qPCR test, and this is with many thanks to the great work of Dr. Desiree Spriggs and her team at the Helix Laboratory. This test has 3 main steps, the first of which requires to open up the virus or bust it open so that we can get the genetic material out. This is called the extraction process, and it has to happen under a special UV hood. Gratefully, in Bermuda, we have 2 locations on island that has this. This includes the hospital and also at the Southside Laboratory. The virus's genetic code is actually made up of something called RNA. Maybe you've heard of DNA. This is more common to everyone, but this particular RNA is not able to be used for the next step. So what we need to do is convert the RNA into DNA. This is the second step, where we do something called reverse transcription, which changes the RNA slightly into DNA. This is what the RT part of RT-PCR stands for. The final step is called the process of PCR, or polymerase chain reaction, which is essentially photocopying of DNA. So if we start with 1 piece, we make 2, and then it becomes 4, and then 8, etc. What we do is we use a particular part of our reaction called primers, which are like fish hooks that fish out the particular code of the virus that we're looking to copy. What makes these interesting is that they have a fluorescent dye, which allows us to detect how many copies of this gene is present. We use this number to tell how much of the virus is there, and that's what the Q in RT-qPCR stands for, is quantitative. At present, we have 3 different FDA-approved RT-qPCR kits on island. The fact that we have these 3 tests is actually advantageous to Bermuda. Each kit looks at different genes and in different positions in the virus, allowing us to confirm one test with another and have that extra sense of security. We can currently look for the coronavirus family genes, which are known as the E and N genes, and also all 3 kits look at the COVID-19 specific RDRP gene. The sensitivity of these kits ranges from 3 to 10 copies per reaction. So if there are as little as 3 strands of the virus in your sample, we should be able to pick it up. The second type of testing that the WHO recommends is the serological test, also known as the antibody test. Antibodies are our body's first line of defense against anything that is foreign. Overall, antibodies trigger the immune response, which results in destroying whatever that foreign intruder is. There are 2 different types of antibody tests, both of which are on island. The Helix lab will use one where you have to draw blood, and we in the other lab will use one that uses a rapid finger prick test. Having them both on island again is extremely advantageous, as it allows us to look at different types of information. Both tests ultimately let us know if you have already been exposed to the virus. The finger-pricked antibody test only takes 10 minutes to give your result, and it looks at 2 different types of antibodies. This is the IgM and IgG. This information will allow us to understand how far along the infection stages you are. If we test and we only see IgM, which is the first responder, then it suggests that you are in the early stages of infection and that potentially the infection is still in your system. If you have IgG and IgM, you may be a bit further along in the timeline of the infection, and you could potentially still be very contagious. The IgM shows a shorter time response, whereas the IgG is a longer term response. If you only have IgG, then it shows that you had the infection a longer time ago. Now, the rapid test kits that we have on island are very good in terms of their sensitivity. We have already tried them on known PCR positive and known PCR negative people in Bermuda, and it came back 100% correct. These are verified by the Australian Ministry of Health, and as you may know, Australia is doing very well in terms of managing the pandemic. Our next step after doing this small validation study is to then test all of those who have been PCR positive before April 15th. That gives us 3 weeks since they were positive, to determine a clearer picture on the sensitivity of these tests in our hands in Bermuda. With current PCR testing, you're at a dead end if you are trying to find out how someone received the virus. If you test all known contacts and they come back as negative, then we don't know where you got it from. Using the antibody test will allow us to fill that gap. Combining the current PCR test with the antibody test will make each tool more powerful, and their efficacy is enhanced when used together. Going forward, we aim to offer this test in conjunction with the PCR test to healthcare workers and frontline workers. Antibody testing will allow us to figure out the level of exposure in Bermuda. However, I want to clarify that because you test positive for these antibodies does not mean you are immune. This is primarily because the world is still trying to figure out how this virus works. And as a global science community, we are still not sure if you overcome the virus once, that you are now set for life to be able to defend against it. Also, I want to stress that the antibody test should not be used in isolation as a diagnostic testing tool at this time. The third type of testing is the viral genome sequencing test. And what this allows us to do is to look at the full exact genetic code of the virus, which acts as a sort of fingerprint. So everyone in Bermuda has a different fingerprint. We can tell who you are. In this instance, the virus will have a slightly different fingerprint from another, and we can tell it apart. In partnership with Public Health England, by the end of this month in Bermuda, we will be able to start to send some of our samples to the UK to be sequenced, and also at the same time do some sequencing here in Bermuda. Combining these two methods, one which looks at the long read sequencing, which will allow us to look for any large deletions or insertions that have happened in the virus, as well as the short read sequencing, which will be done in the UK, which will allow us to look at single mutations. This will help us to understand how and if the virus is mutating. I am pleased to announce that in Bermuda, I will train young Bermudians on this new technology called nanopore sequencing, which is actually what I do at the University of Oxford currently. Viral sequencing will help us to see which strains entered the country. It will also allow us to see if when it got here, if it has also changed in those that have been positive. I want to stress, we are not sequencing the people, we're only sequencing the virus that is inside those people that were positive. It will also inform which individuals have which version of the virus and may allow ESU to connect some of the dots of infection. As we look ahead to the short-term future of COVID-19 testing in Bermuda, we want to be in a position where we can actively test the general population for COVID-19. We never want to be in a position where we have to prioritize who gets tested over who. This will help us to identify the asymptomatic population who do not know that they are infected, and ultimately will allow us to combat this virus in Bermuda. Thank you, Mr. Premier.
Thank you very much, Dr. Weldon. And thank you again for coming home and the work of which you and your team are doing. And I can say without fear of contradiction that if it was not for your tenacity to assist us in scaling up our testing capacity, we would not be leaders globally in testing our population for the novel coronavirus. And I have to say this, although some people will get upset at me, the slings and arrows that the minority in Bermuda have tried to throw at you should be deflected by the enormous admiration that young and old, black and white, and everyone holds towards your particular accomplishments and your work, and your country is incredibly proud of you. Now we have Minister of Public Works, Lieutenant Colonel David Birch, who will review the guidelines for entry to government offices and the work that is being done within his ministry. Colonel?
Thank you, Premier. Good evening. Everyone will be aware of the restrictions we have endured over the last 6.5 weeks, from scaled-back government services to shelter in place. Despite the closures, the Ministry of Public Works, with responsibility for all government assets, which include public lands, beaches, public parks, government buildings, water distribution, sewage disposal, solid waste management, and refuse collections, continued operations virtually unchanged, as most functions are essential services. On the front line are our sanitation workers and the staff at the Tynes Bay Waste-to-Energy facility. At the start of this crisis, there were some challenges with refuse collection. They were swiftly resolved, and collection not only continued, but in fact The teams improved their performance by completing their assigned zones before 2 p.m. daily. It is also important to note that there were no health and safety incidents during this period. The Tynes Bay Waste-to-Energy Facility, a 24-hour, 7-day-a-week operation, and an almost entirely Bermudian-run operation, adjusted seamlessly to the changes and carried out its role with little difficulties. I remind that this facility generates a significant amount of electricity that is sold to Belco, and the benefactor is the Bermudian taxpayer. Other challenges involved individuals placing garbage for collection curbside after the area had been serviced, and illegal dumping across the island. The issue with residential garbage collection was quickly resolved, with government supervisors visiting those responsible parties. The illegal dumping is still to be addressed. It is a source of significant disappointment and irritation for me. As such, there are several options available for enforcement that are being explored. I am determined to take the necessary and possibly controversial steps to curb this behavior. While we were learning and operating throughout the shelter-in-place, we also began preparing for the inevitable reopening of government. In anticipation of that decision, it was decided that returning to work would be a gradual process dependent upon several factors, such as the ability of staff to attend work when nurseries, schools, public and private, and public transportation remain offline, determining how staff can function in their respective workplaces while adhering to the new social distancing requirements, and the ability to keep frontline employees safe while interacting with customers. In preparation for the reopening, the Ministry of Public Works developed protocols that outline how we can safely resume providing the necessary services in government. This involved the Ministry of Public Works Health and Safety Officer consulting with the Ministry of Health and Safety Officer consulting with the Ministry of Health regarding the proposed protocols. Following this initial consultation, the 4 health and safety officers from Tynes Bay Waste-to-Energy Facility, the Ministry of Health, the Ministry of Public Works, and the Cabinet Office worked together to draft the protocols and procedures now in place to reduce the transmission of disease amongst our workforce and the community we serve. With the government now open and operating in a limited capacity, we continue with our phased approach of a gradual return to work, wherever possible, to reduce the number of persons in the office at any given time, including opportunities to work from home that are being encouraged. For those working in government offices, the recommended physical distancing between employees is 6 feet, which translates into a 28 square foot circular area allotment per person. However, due to different office layouts in practice, it is appropriate and more practical to double this number to 60 square feet. And considering the current government space standard per person is 65 square feet, physical distancing in government offices is assured. In addition to the physical distancing, we have also implemented the following protocols for entering government buildings with the necessary signage affixed to inform and reinforce the message. All persons entering government buildings or facilities must have their temperature taken, wear some form of face mask, cleanse their hands via the hand sanitizers available at the entrance to each location, and a maximum of 1 or 2 persons are allowed in an elevator at one time, depending on its size. There were concerns expressed regarding the air conditioning systems in buildings, with some reports indicating that the virus could be spread through the building's air conditioning systems. To address this issue, the ministry consulted local air conditioning vendors, who in turn provided assurances that this can be mitigated. As such, all air conditioning systems in government buildings were deep cleaned before reopening, along with all workspaces. Despite the challenges we will face going forward, the ministry is confident that if the aforementioned protocols are adhered to, the risk of spreading COVID-19 will be greatly reduced, permitting the government to slowly expand its business operations. Thank you, Premier.
Thank you, Minister Birch. The Bermuda Police Service and the Royal Bermuda Regiment will be enforcing the evening curfew between the hours of 10 p.m. and 6 a.m., conducting both patrols and checkpoints. The regiment is keen to ensure that essential and exempted people are inconvenienced as little as possible. Enforcing the regulations during daylight hours means the police and regiment will ensure they have a visible presence in public spaces. The public should expect to see regulations in force at all public parks, beaches, golf courses, railway trails, and authorized businesses. The Coast Guard will enforce the regulations on Bermuda's water. This will include commercial boats, pleasure craft, and areas such as inshore waters, harbors, private docks, recreational areas, and marinas. There will be an increase in the number of regiment soldiers working over the weekends to deter large gatherings and to inform the public of these regulations. The public is advised to reread the legislation and the physical distancing enclosures document so you are not accidentally in breach of regulations. Under the current regulations, there remain specific categories of businesses that must remain closed. For example, bars and clubs, spas, gyms, barbers, beauty salons, sports clubs, and restaurant dine-in services. For other businesses, the law still requires an employer to arrange for his or her employees to work remotely from home if that is reasonably practicable. Those businesses that cannot operate remotely, such as construction, landscaping, or the outdoor showing of real estate, are no longer required to not operate, but what is important is that appropriate physical distancing is strictly observed. Customers are not permitted to enter the business premises, so that any businesses provided are only available for curbside or delivery collection or done via phone, the internet. It is still not allowed for any employer to force an employee to come into work where that person can reasonably work from home. Any employer who does that will be in violation of the law. Mandated working from home in the private sector does not end until phase 3. Where appropriate physical distancing is not observed, the regulations permit the Minister of Health to close the businesses until there is compliance with these important public health conditions. The devastating impact of COVID-19 has created massive economic disruption and displacement to workers around the world. Here in Bermuda, we began to address this impact on our economy through the introduction of the new unemployment benefit, which has seen $15 million paid out to date and provides a safety net for our workers through this program. Additionally, to support small and medium-sized businesses, the Minister of Finance has given a grant of $12 million to the Bermuda Economic Development Corporation to assist those businesses during this time. On Friday, the House of Assembly will meet to pass legislation that will provide further economic relief to Bermudians. Under the proposed amendments to the National Pension Scheme, which were approved by the Cabinet yesterday, we'll expand the scope of existing provisions for financial hardship to include a one-time withdrawal of up to $12,000 from persons' individual pension accounts. There are those who will raise legitimate questions and legitimate concerns about the impact that this could have on the long-term health of persons' individual pensions. We share those concerns, but it is clear that this is not any normal time. Funds like this should only be accessed in emergency situations, and it is undoubted that the massive amount of unemployment that is seen in our economy due to the restrictions that are necessary to put in place to preserve life is such an emergency. The reality is that there are people suffering today who need assistance today, and the overall health of our economy requires help today. This money is Bermudian savings largely overseas, and bringing some of that money home is the right move at this time. This will have no impact on anyone currently receiving pensions and no impact on those persons set to be eligible to receive pensions over the next couple of years. It is important to note that withdrawals can only be made from individual defined contribution plans. Those are, as we call colloquially, private pensions. Withdrawals cannot be made from the government social insurance fund or cannot be made by public officers or those persons who work in quangos, such as the hospital and other places, from the Public Service Superannuation Fund or public officer pensions. These are defined benefit plans, and other defined benefit plans are not eligible for this one-time withdrawal. So, to put it simply, you will not be allowed to dip into anyone else's savings. These funds will come from individual savings that persons have saved up over the years. It is your money, and at a time like this, your money can be used to help our economy. Applications for participation in this relief initiative will be administered by the current pension plans administrators. In developing this relief program, we consulted with the opposition, who have agreed to allow a process which normally takes weeks to be conducted in one day in the House of Assembly on Friday. I'm grateful to the opposition for their support and cooperation in moving this forward. This relief, and I'm also, grateful to the Speaker of the House for allowing us to be able to move this in virtual session on Friday. This relief and initiative has also received the endorsement and support of Bermuda's Pension Commission. The Minister of Finance will provide further details on how to apply for this relief and other details once the legislation has completed the legislative process. I encourage everyone to listen to the House of Assembly on Friday, when we will have another virtual session. You can hear the details of the plan as the details are laid out, and the House of Assembly debates this legislation on how we can help Bermudian families navigate these extraordinary, challenging times. On Friday, the House of Assembly will also debate the new regulations which were put in place to govern Phase 1. I would like to remind persons who are at home, who are watching, and for those persons who are suffering emotional or mental stress, to please take advantage of the hotline which has been established. That number is 543-1111. Before I close tonight, I would like to echo the Minister of Health in reminding persons to wear masks in public and continue to practice your physical distancing. The only way that Bermuda is going to keep this virus at bay is if all of us follow the rules which have been laid out. Any person who does not causes an issue for all of us. The closer we adhere to the rules, the more we avoid leaving the house unnecessarily, the sooner that we can start moving to the next phases. When you leave your house, it is very important that you continue to practice physical distancing. I know that it is difficult sometimes to be patient, to wait inside of these particularly long lines, but this is our new normal, and the only way that we are going to be successful is if we adhere to these guidelines. So please be kind, be considerate, and be patient. And I would like to thank the team at Bermeans, in conjunction with Coral Close Clothing, who donated these wonderful new Bermuda face masks, which I'm sure are lovely for all to wear, and thank you for them. The health and safety of each and every one of you remains our driving motivation and at the heart of all the decisions which we make. Our hearts go out to everyone who has lost loved ones or who have loved ones currently wrestling with this disease. Our hearts go out to the workers and businesses that have seen their ability to provide for their families and meet their obligations significantly diminish. And our thanks go out to everyone, everywhere across our community that has done their part to help our community get through this. The next press conference from this location will take place on Monday afternoon at 5:45. We will not be having a press conference this week Friday, as the House of Assembly will be meeting in virtual session, and all persons are encouraged to listen to the House of Assembly session that will be taking place when we would normally be here doing our press conference. We will pick up again next week for Monday, Wednesday, and Friday, where we will have more details on what is necessary and required to advance Bermuda from Phase 1 on to Phase 2. And there will be presentations from other ministers on the various initiatives that the government is taking to move the country forward. Before I close, I would like to thank all of those persons in the community who are supporting each other in the search for the missing young lady, Chevelle Dillon Burgess. I just would like to say thank you for your efforts in that search, and it proves that us as a community can work together in times of crisis. With that, I close, and I'm happy to take any questions from members of the media.
Thank you. Good evening. Premier, the best lessons learned are from making mistakes. Do you feel you've made any mistakes? If so, what would you do different if you had to do this all over again?
I would not be able to name all the different mistakes of which the government has made over this past time, but I don't classify them as mistakes. There is no playbook that is written for managing a pandemic. But I think if you look back at what we've actually managed to achieve over the past, I would say, 7 weeks, between making sure that we're able to scale up our testing capacity to, with today's results, possibly putting us in the top 10 in the world, the fact that we've been able to deliver relief to small business and individuals where there are far larger companies, the countries than us, who are struggling on delivering that relief to individual citizens, the work of which we've been able to do collectively, I think that we've done a relatively good job. There are certain things that you would balance. Sometimes you wish that, maybe you got to one email before another email, which may have gotten one thing done before another thing. But I think that we are continuing to learn, and I think that we are continuing to improve. So there'll be plenty of time for an inquisition, I'm certain. There'll be plenty of time for persons to ask, well, you should have done this, well, you should have done that. But our job right now is to work and focus on the next steps, because the country needs to recognize what's necessary to rebuild and recover from that. And I've been adamant in saying that I do not want the economic crisis that follows this healthcare crisis to be worse.
Also, Premier, it's been confirmed that a member of the Bermuda Fire and Rescue Service and the Customs Department have come down with the COVID-19 coronavirus. Are there any other persons in the discipline service, i.e. Immigration, Bermuda Police, or Corrections Department, come down with this virus?
To the knowledge from the Ministry of Health that I have, I think the answer is no, but I think on a broader level is that we're not trying to actually reveal those things. And so over the weekend, when there was a revelation of someone from the Bermuda Fire and Rescue Service, there is a particular challenge that we have concerning the privacy of persons. So I think that going forward, we might actually be a little bit more private in releasing that particular information. I think we give overviews, but we have to remember that persons have families. And I think the Minister of Health has been very clear that some of the disclosures which take place actually prevent us from doing the work to fight the virus. So if people feel that their identities might somehow be revealed, if people feel that in some way, shape, or form, they are less likely to share information, and that actually makes Bermuda's position worse in combating the virus. Do you wish to add anything to that, Minister of Health?
No, actually, well, yes, sorry, Trevor. I can't agree more with what the Premier said, because unfortunately we live in a very, very small community. And as I said several times as recently as, I guess, on Monday, that the insatiable desire of the press to know all the intimate details can be obstructionist, because we, due to the size of and the nature of our community, what we don't want to do is have persons that we're trying to contact with respect to contact tracing not wish to provide us with information because they're concerned that whatever information is provided may be revealed publicly. So we have to be mindful that when you live in a small community, we have to make sure that our efforts are such that we're not disclosing too much information about persons that could reveal the confidential nature of a person's diagnosis.
My last question for you, Premier, is has there been a dispute regarding the Minister of National Security and the Minister of Health not agreeing in the budget used to purchase the PPEs for the Bermuda Regiment?
Well, I can say I know of no such dispute, but even if there was such a dispute, I can tell you that I would never share that with the media or the public. One of the things about a cabinet-style system of government is that the best way to ensure that best decisions are made is that inside of the cabinet chamber, all ministers can have a free and flowing debate and discussion amongst themselves. But I believe that we are all unified in making sure that we have the PPE which is necessary and required. Let's look where Bermuda is compared to other countries. We've gotten supplies of PPE. I think 500,000 N95 masks arrived the other day. With 400,000 surgical masks arrived the other day. We have face masks. We have testing. We have 3 different types of testing equipment. We have 2 testing labs. We are in the top 10 in testing in the world. I think that we're doing a pretty good job. So as it goes back almost to your first question, that yes, there may be times when you look at things and say, oh, this and all the rest. But disagreements is what is necessary and healthy to arrive at the best decisions. And I think that is what the government as a whole is clearly and particularly demonstrating.
Thank you. Minister Keynes, and the Premier just made mention of the investigation or of the young lady that's missing. And you are aware an investigation is at present looking for this young woman that's missing. What might you say to the community that might comfort or resonate some more awareness for that neighborhood?
Trevor, I can say right now that someone is in custody assisting police with their inquiries, and just encouraging members of our community, if they know anything, please do the right thing and say something to the Bermuda Police Service. You can call 211 or 295-0011 and share with the police any information that you might have.
Can you confirm or deny this individual is
I can deny.
Sorry?
I can deny.
Okay.
Next.
Yeah.
Good evening, Health Minister.
Good evening.
Cases under investigation dropped from 18 to 10 since the weekend. How many of these were solved and how many went past the 4 weeks limit that you mentioned earlier tonight?
I didn't hear the last part of your question. You said cases?
Sorry. Yeah, how many of the cases were solved and how many went past the 4 week limit of not being solved?
But you said they dropped from 8 to 10, right?
18 to 10.
18 to 10. So those other 8 that we spoke about, as I spoke previously in the message, in the statement, we have a number of different classifications, right? So we have the local transmission, we have the imported transmission, which we know what that means, and then we have under investigation. After 4 weeks, after the investigation has taken place after 4 weeks, then they transfer that classification to either imported or local. So when you would have seen the changes in the from 18 to 8, it's because, and you'll note on there, and I don't know which ones in particular referring to, they would have been then, therefore, following the investigation, classified as either local or imported transmission.
Okay, just for clarification.
Sure.
So of those cases, how many were moved to local? I guess. Sorry, never mind. I understand. They all
So
moved to
we went
local
from
because they
18
went
to
past,
8.
because
So
they went past the 4 weeks.
exactly.
Okay, thank you. Tonight you mentioned there were 3 more positive cases.
That's correct.
Of those, how many were imported? How many were related to the rest homes? And how many were local?
That is still under investigation. It's still early time. In fact, all persons haven't been notified. So it's too early for me to make any comments right now.
On Monday night, you said that 90% of the positive tests recorded at Westmeath and less than 50% at Matilda Smith Williams residents were asymptomatic, in addition to several from the Airbridge flight. Were these persons asymptomatic or pre-symptomatic, and have they all remained asymptomatic since testing positive?
Thank you, John. That's a very good question. I think the first and foremost of importance with respect to those persons in the rest homes is that we can report that each and every one of them are in stable condition and remain so. You would appreciate that the epidemiology and surveillance unit has quite a defined role, and the principal role at this point involves surveilling, doing the contact tracing and the like. The case management of every individual that is tested positive is done by their physician. So their physicians would be the best persons posed with being able to provide details as to whether or not a person remained asymptomatic or symptomatic during the course of their treatment. So the physicians collect that information, and they're not required to provide that to epidemiology and surveillance unit.
Okay, thank you.
Mm-hmm. And that's likewise with respect to those persons that were on the air bridge. They would have their own private physicians who would be providing the case management for their patients.
Of the positive cases found at Matilda Smith Williams, Westmeath, and the Airbridge flight, We are interested in how many have recovered to date. If so many were asymptomatic, it's notable that the non-hospitalized active cases only moved from 44 persons on April 22nd to 38 persons as of this morning. The total number of non-hospitalized patients has only dropped by 6 persons in the past 2 weeks. We would have expected to have seen more recovered cases by now. What are the reasons behind this?
Well, like I said, in addition to the physicians being the ones that are providing the case management, because we've seen outbreaks in both those rest homes, we will continue to monitor them, and they're on heightened monitoring through the ministry. And in addition to continuing to monitor them, all of those places will be retested. I think 2 days ago I spoke about Matilda Smith being retested, all the staff and the residents, and likewise that will also take place with respect to Westmeath.
Okay, thank you.
Mm-hmm.
Does the government have an estimate or a model for how many asymptomatic cases there may currently be in the local population right now?
As I spoke about previously when we've spoken about the modeling, and I can repeat effectively what Ms. DeRosa indicated when she was here revealing the modeling to members of the media, we are in the process of updating the model and Bermudianizing it, so to speak, with the assistance of Aaron Evans as well as Mr. Miners, Dr. Kevin Miners, as well as the epidemiology and surveillance unit. So we are Bermudianizing it and updating the data currently. And once that has been completed, I can assure you, as was released with the modeling, as was the case with the modeling, it will be released publicly, and you'll be the first ones to receive it.
Do you have any estimate as to when that modeling will be released, and if Dr. Weldon will be involved at all?
Dr. Weldon is extremely busy. I'm sure if she wants to help doing some modeling and pull her out of the lab, then we would welcome that, but I think she's got her hands full conducting hundreds of tests every day. We do, like I said, we're going to be able to utilize more Bermudian young talent to assist with that, and as soon as it's completed, we will be able to provide you with more details.
All right, thank you very much.
Do you want to add anything to that?
I am not a mathematical modeler. I am a scientist, although I love math, but I will stay in my lane on this one.
Thank you very much.
Good evening. Aaron Hill on behalf of Bird News. Minister Wilson, you have indicated that the government will no longer routinely report certain numbers and information regarding COVID-19 cases due to privacy concerns. There are many who say that regular updates regarding this information is how or will allow the public to measure the fluctuations in spikes of critical cases and is a key indicator of where our cases are actually emanating from. Can you please advise what your rationale is for now withholding this information on the basis that you were previously releasing it?
The fact that we are a small community and that information needs to be shared on an as-needed basis. We all, and I'm not trying to be personal to you, but we all have parents and family members and relatives who we would not want information to be disclosed through the media without them having the first opportunity to hear it directly from their doctors. If you look at all other jurisdictions, Cayman included, they do not reveal as much information as we do in Bermuda. They list the amount of positives, and they list the amount of recovered, and they list the amount of deaths. Some don't even, that's it, those 3 parameters. And perhaps we can start rolling back the amount of information that's provided. We will always provide regular updates to the members of the public because that's critical. That information is public. It's filed on our website. However, most countries only reveal limited information such as the number of positives, the number of tests, and the number of deaths. Especially countries bigger than us are not being drawn into the minutia of revealing details that could clearly identify persons in a population of 65,000.
And I may add to that. I think, Aaron, I challenge the classification of your question to say that the information is being withheld. I mean, at the basis of it, that the information may be being withheld, as the minister said, she's laid out specific paradigms. So if there is a case that's found at a rest home, unless it is a member, a resident there, then that rest home is not going to be named. One of the things in which I've said, if there's a case for someone in a particular service, then we might not name the particular service in which that person, but it's not as though if we are not going to say that the amount of persons that have contracted it, it's not as though if we're holding back that particular information because it is a reportable disease and that information is being reported. But I can just speak to the fact that this weekend we had an issue when it came to the revelation of a case of someone inside of the uniformed services and the challenges of which we face with the contacts, et cetera, who did not want to submit to something because they were afraid that their privacy in some way, shape, or form may be breached. So we're going to be very careful, because the most important thing to do in this is to manage the public health crisis. And we can only do that with cooperation from persons who may have been exposed or may be contacts of those who may have been exposed, who do not have fear that their confidentiality is going to be breached. And because Bermuda is such a small community, people just are very fearful of that.
Grateful, Premier. So in respect of the change of stance, because the government was previously releasing this information and now it holds the position that to do so would be a breach of privacy.
Can you just clarify what information specifically are you talking about?
So, for example, I think another reporter just asked with respect to whether or not it was in a disciplined service. On last week, Friday, the minister said there would be no more numbers with respect to ICU, numbers without a name, just numbers in ICU. So now the government holds that that information is not going to be withheld when previously it was releasing it. So my question to you, Minister Wilson and Mr. Premier, is now, in light of your change of stance, do you concede that by releasing the information before you had breached patient confidentiality?
No, I don't believe that we've breached any confidentiality, and I'm not conceding that point. But what I am saying is that, again, recognizing the size of the community and the information that is the community's, and particularly the press's, insatiable desire to know more than is probably necessary or required, what I'm more particularly concerned about is the release of confidential information or information that could help identify the persons that we're speaking about. And again, as the Premier indicated, given the size, we found this weekend that there were some challenges with respect to contact tracing, because people were concerned, if I provide you with information, is that information going to be public? It's one thing if somebody works in a building that has 250,000 people. Well, let's use Bermuda as an example. You work in a company that has 250 people, and one person tests positive. We have to do the contact tracing with those individuals that may have had contact with that person. When we do contact tracing, Aaron, we don't even tell them who is the person that they were in contact with that was tested positive. At the end of the day, COVID-19 is going to be here for a while. We recognize that. But what's really critically important is that we have confidence in public health after the COVID-19 crisis exits, because there will be other pandemics, God forbid, but there'll be other reasons why we need to have the confidence maintained in public health.
If I may say one thing, Aaron, when you speak about the issue of those persons in critical care, I think that critical care is something that is a particular metric. And I'm happy to go ahead and have that conversation, because it's not about holding back information. I think the minister last week said the issue of ventilators and ICUs, but that's a conversation, discussion we can have. But we're not trying to hold back information. We're literally trying to balance a real issue here, that with the level of information of which sometimes is disclosed, it is running us into trouble on the contact tracing side. And that is something that the chief medical officer is having to balance, because as a country, we will not be as successful in combating this disease like that. So it's wonderful for a place like New York, who might have 10 million people, to say ventilators and all the rest. Here in Bermuda, it's a little bit more challenging.
Thank you, Premier. Mr. Premier, many students who graduate this year have expressed serious concern at their prospects of obtaining employment in the post-COVID-19 economy. Given that these young Bermudians haven't been laid off as such and wouldn't be eligible for the unemployment benefit, can you please advise what this government plans to do for them?
At this point in time, the first thing which we're going to do is we're going to make sure that we maintain our summer employment programs. There's been some question as to whether or not that's going to happen. I know there's been some miscommunication which may have gone out. The cabinet was unequivocal yesterday that those programs will continue, and those will not be something that is subject to budget cuts, which are going, when we're looking for savings inside of our particular budgets. In addition, I think I'd spoken previously that we want to make sure that for those private sector companies who have decided that they're going to pull back their summer employment items, that we're going to make sure that we strongly ask them to reconsider. At this point in time, this is something that is not the time to pull back on that level of assistance, and whether or not persons working in office are able to participate in projects remotely, I think that it's helpful in that particular regard.
Thank you, Premier. After receiving criticism from yourself and the Minister of Finance, Butterfield Bank released a statement defending its decision to make larger interest rate cuts in the Cayman than in Bermuda. Butterfield stated Cayman's economy has grown at an annual 3% rate over the past 5 years in real terms, compared with Bermuda's 0.1% growth. Bermuda's government debt burden is more than 5 times greater than that of Cayman. What, Mr. Premier, do you have to say in response to Butterfield's stated rationale?
What I would say is that from a plain and simple economic perspective, to say that you're going to have higher interest rates and that's going to help an economy does not make sense and doesn't make sense in any economic book. But what I will say is that I believe in this time of crisis that it's important that we all work together for the best interests of Bermuda. And while we accept that the decision of the local banks provide deferrals and loan and mortgage payments provides customers with some level of increased liquidity, we all think that they can go further. And even if they were to reduce their rates by a further 50 basis points, they would still make money on their particular loans. So the fact is that to argue that higher interest rates is somehow going to help an economy does not actually make sense. It's basic economic philosophy. When you have a difficult economy, you cut interest rates. That's the reason why the U.S. Federal Reserve has cut their interest rates to 0, and you see 0% interest rates on core borrowing across the world.
Perfect. So in light of your response and the fact that you've indicated on several occasions that you've given these institutions like Butterfield Bank an opportunity to take steps to assist Bermudians, for example, by reducing their interest rates, based on their firm stated rebuttal to your criticism by way of their refusal to lower the rates further than they have already, will you now move beyond verbal cautionary warnings and actually mandate legislation, or will you effect legislation to mandate the reduction in interest rates?
I think that there are some who may say that that is an easy solution, but that might not actually be a workable solution. And I would happen to say that at the end, I'm a scientist, kind of like Dr. Weldon, although she is a biomedical science and I'm a computer scientist. And the way in which you approach things is how best to solve the problem. That might not be the best solution to the problem. The problem is interest rates in Bermuda are too high. Legislating interest rates might not actually solve the problem because you might end up introducing other particular problems. What we have to do is to make sure that we have lower interest rates in the country. It is something that the Minister of Finance has spoken about, and I think the Minister of Finance has been very clear that no options are on the table. But one thing I'm not going to do is Sorry?
You said no options.
Okay, all options are on the table. But one thing that I'm not going to do, Aaron, is try to make policy inside of a press conference.
Perfect. So given that the government has already borrowed enormous amounts of money from local institutions like Butterfield and thus is itself a borrower, do you consider this government to be in a compromised or less desirable position to enforce legislation?
No.
Grateful.
Good evening, everyone. My Placer here for Media Maya. My first question, but also firstly, thank you, Dr. Weldon, for all the work that you are doing here in Bermuda. You didn't have to come back home, but you did, and we are truly grateful and appreciative of you, and you're truly an inspiration to many people on this island. So my first question for you, and please correct me if I'm wrong in my wording, you stated that you'll be teaching students how to use nanophore sequencing to determine which strains of viruses has entered the country. I would like to ask, how can persons be selected to be under your teachings, or have they been already selected for you to teach them?
First of all, thank you for your remarks at the start. I'm very humbled to come back. And I think that as a Bermudian who has been invested in over the last 12 years via scholarships, it was my duty to come back and give that return on investment. As far as to selecting students, it's been similar to those that are working in the lab. I get emailed a bunch of people and I have a chat with them and see who has the most keen interest in it. And I have a meeting with them and see which one is the best. So anyone who's interested, please reach out to me. I will give you my email. Is that okay?
Sure.
Yeah. Yes. My email is cweldon, so CWELDON @WELL.OX.AC.UK. And I personally deal with any students that are interested. So please reach out. The nanopore sequencing is something that is quite exciting. So I'm looking forward to receiving those applications.
Thank you so much. And then my next question goes to you, Mr. Premier. There was an update that you mentioned about a charter flight on Monday's press conference. I just want to know if there's any further update, as I have actually been given a lot of questions as to what's the flight number, or are there enough interest in it, and will it be confirmed?
That is a charter flight. It's not able to be booked online, going on Expedia or anything else. So they have to contact. It's being organized by Travel Edge. And I think in my remarks, I said that person should contact Travel Edge, info@traveledge.bm. I believe that was the email address that I gave from Monday's remarks. I don't have them in front of me, but the email address that I gave there is for persons who are interested in that flight, either coming to Bermuda, which will require them to be in a government quarantine facility for 14 days at a cost of $100 per day, or leaving the country. I have to make sure I add it there. Or leaving the country, they can contact Travel Edge, but it is a charter flight.
Thank you. And also to mention flights again, can you please just reiterate how flights are being sent back and forth from Bermuda to other places like the UK? Because many students are wondering, oh, when's the next flight going to come? But they don't understand that it takes a lot of effort and movement to make that happen.
Absolutely. The return of regularly scheduled commercial air traffic is not until phase 4. So it is hard for me to say when regularly scheduled commercial traffic will return. Persons who came back to Bermuda who want to leave, if that is the case, then they are, I guess they can take the charter flight to the US and hope they can get a flight to the UK if that is their particular desire at this point in time. But we won't have a clear picture as to when. I'm hopeful to have the Minister of Tourism here next week, who can discuss on those matters in depth. Also to have the Minister of Finance back next week to talk about a few more matters regarding the economy. So certainly we'll be able to enlighten on those particular matters. But I really don't believe that it is realistic that we're going to see scheduled commercial air traffic return before the summer.
Thank you.
And the summer is June 21st.
Thank you.
That's not setting a date for phase 4, by the way. I'm just saying it's not realistic to say that that's, I don't think it is. I think we are a little bit ways away from getting back to the time where we have a flight a day from New York, a flight a day from London, or even, 2 or 3 flights a week. We're ways away from that.
Understood. I think most of the students actually who are in the UK were just wondering about like a charter flight, like how there is one from, Atlanta to Bermuda right now that is not scheduled, but if interest is enough, it could come to Bermuda. And so those students who are in the UK are wondering if a flight like that would be coming about soon.
We had 2 charter flights from the United Kingdom already. One of them was full. The second one, we fulfilled the demand which were there for students who wanted to return. So I don't believe that there is a prospect of there being another UK charter flight in the near future. I don't actually think there is.
Thank you. And my final question for you, Minister Keynes, would be, can you confirm that the police and the regiment are going out to check the retail businesses and other opening businesses tomorrow and the day after that?
Absolutely. They've been doing that since Saturday, and the Bermuda Police Service and the Bermuda Regiment, they are looking at checking out businesses across the island. And so they have literally, they're doing the community action points at night from 10 p.m. until 6 o'clock the next morning. And during the day, they're going to businesses on the island and to the beaches and to the parks to make sure that people are following the regulations.
Okay. And one follow-up, if I can, is just some retail owners are wondering if they can get at least one person in the store to do a shopping.
Oh no, they're not a security force, and so they're not there for the benefit of the shopkeepers. Shopkeepers need, if they need that type of help, they need to employ private security companies to help them in that endeavor.
And if I may, retail opening is not in phase 1. Retail opening is in phase 2. So the answer to that question is no. And unfortunately, that's where we are. We're going to take it phase by phase, and we're not going to roll back and relax restrictions until we are confident that we can do it in a safe manner.
Great. Thank you so much.
Good afternoon, all. Owen Johnson-Barnes with the Royal Gazette. Dr. Weldon, you mentioned earlier the sensitivity of the tests, how accurate they are that they can catch 3 strands of the virus in a sample. In a layman's terms, what sort of ratio is that when it comes to false positives and false negatives? If there were 1 million cases taken, what percentage of them would be off?
So that's a very good question. It's not just to do with the sensitivity of the test. Actually, PCR, if you get a good sample, it will find it. That's kind of the main point. Really, when it comes to doing the PCR test, the issue is about when you take the sample from the person. Is it too early in the infection? Is it too late in the infection, so it's not even in the system that we can pick up anymore? Or is it even in the nasopharyngeal place? That's all an issue. So it's not necessarily about the test itself. PCR is very sensitive. It's used in a plethora of different molecular diagnostic applications. Is actually getting the sample that has the RNA virus in it. That's more an issue. So I can't give a number per se, but it is being talked about. I had a chat yesterday with an immunologist in the US who works with the FDA to try to test these rapid kits. And he was saying that what his stance is actually he will do the PCR test and the rapid kit at the same time so that he can get a better picture. Because sometimes when we see that someone has been positive and then they test negative and then they test positive, people are thinking it's a reinfection. But actually what it is the PCR test missed it the second time. And so it's not necessarily a reinfection. So it's not that the test is not as sensitive, it's more about getting the right sample at the right time.
All right. Now, Dr. Weldon, as Premier Burt mentioned earlier tonight, you have been the subject of some criticism, people questioning your qualifications. How do you respond to that?
Yes, that is very true. I think the best I can respond to it is just to do the work, really. My work has been online. I think I'm a scientist that is published, and reverse transcription and PCR in my papers that I have published, both of which are first name author papers, which means I did most of the work. Other than that, I think just to come back and actually do the job and get it done is the best response I can have to that, really. Yeah.
All right. Mr. Wilson, now, I understand earlier that we're still working on the Bermuda model. Do we have any updated figures on the R0, the reproductive rate of the virus in Bermuda?
No, that's part of what they're doing right now, is trying to calculate that and more, like I said, and more Bermudianize it. But they are providing more input and data as we speak. All right. You also gave an update earlier on the care home testing. I was curious about the testing at the hospital, of actual BHB staff. What sort of policy is there in place to make sure that doctors get tested? And because they're, I imagine, regularly in contact with folks who are likely to have COVID-19, are they being tested repeatedly, or is it a one and done? Well, the BHB has their own monitoring and protocols with respect to COVID-19 testing and which staff members test, et cetera. And they are also, as part of those protocols, allowing their staff to get the test at the South Side. So there are a number, I wouldn't know how many because it is part of their protocol, and whether or not they require every person to be tested or not, that information is beyond my remit as well. But they do have established protocols at BHB with respect to testing. Mr. Premier, some islands in the Caribbean have put out calls saying that when they reopen travel, they want to see certificates from the travelers to say that they are COVID negative. Is that something that Bermuda would consider moving forward as it moves towards phase 4?
Thanks for the question, Owen. There are a lot of considerations that are taking place regarding opening of the tourism industry, which is something that we would like to get back as soon as possible, only if, of course, it's safe. And so there's lots of different conversations, whether or not it's, whether you allow people in who have the antibodies, so it's less likely that they'll be able to retransmit, or whether or not it is you let persons in if they it's lots of different calculations there. There are some companies that are looking at using the blockchain to be able to test and to trusted travelers, et cetera. There's loads of things that are being considered there, but I think it's still early days. And given that, we're just entering phase 1 and the reopening of the airport is to phases, on later times, phase 4, we haven't come to the specifics. What I can say is that when the Minister of Tourism is here next week, he can talk about his working group. He does have a working group that has members of both the Progressive Labour Party, the opposition persons from the Bermuda Tourism Authority, Hotel Employers Bermuda, Bermuda Hotel Association, and others working through how we're going to resurrect our tourism industry. So there are lots of things that are part of that, per se, and we are considering, and there's a lot of proposals that come to us, people that are doing things. One of the things that my fintech advisor reminds me, Dennis Pitcher, says that it's not always best to be first, and sometimes it's better to see what other people are doing and do a better job than them. So we're going to take a deliberate look at it, and we're not going to necessarily open up our borders prematurely if that means that we're going to seed more cases here in Bermuda. So we're going to take a disciplined approach to it. Right now, our approach works. People come here, they're in quarantine for 14 days, they're tested before they leave. If they if they don't test negative, then they have to remain under quarantine and that type of supervision. And I think that's something that has worked well. And I can just say that, you know, I made these comments earlier today about, you know, Dr. Weldon and the scaling up of the testing capacity. Dr. Weldon was actually on the second flight from the United Kingdom. And it was at her, you know, urging that we say, you know, yes, let us test every single person who got off that flight. And they were able to, with the Ministry of Health staff who are used to getting directives from me late and having to make sure they went ahead and got this together. But it was an incredible working relationship between a newly established lab to make sure they got the verification process, et cetera, done locally to make sure they could actually do the tests, and the Ministry of Health organized the doctors to collect. We got everyone together, we were able to do 209 tests in one day and to get that done, and that helps to protect the country. If we did not have that, and those 11 persons were released into the community, even after the 14 days, then there may have been particular challenges there. So, I mean, there's lessons that we learn all the time, and I think that overall, when you look at these type of things, these interactions, we're doing a pretty good job. But we're not going to open our borders until it's time.
And last question, Minister Birch. I understand, of course, that because of the financial constraints, some capital projects that may have been on the schedule for this year may have been pushed onto the back burner. I was hoping you could tell us how this has affected the ministry and its plans for the year.
I think it's affecting every ministry. We're all looking at our budgets. We had a session today. What we are trying to do is to balance keeping people employed and making an impact to the infrastructure of the country. We're not quite there yet in terms of what projects might be delayed or deferred. That discussion will take place, I believe, next week, overseen by the Minister of Finance. But our view is it's going to be better for us if we actually make the recommendations on what we should cut as opposed to an edict from the Minister of Finance.
All right, thank you.
Okay. That's it. I want to thank the members of the media for their, sorry, Mr. Kane?
Yeah, Premier, I just crave indulgence for a quick second. Just want to say happy 10th birthday to my godsons, Evan and Logan. Thank you, Premier.
You know, do you have anything to say in closing, Dr. Weldon? Anything, Colonel?
I gave my sign to my PS's daughter.
Anything, Minister Wilson, before I close out? With that, I just want to thank everyone in the media for their attendance. I want to thank certainly the questions which we've had, which is certainly an important part of our democracy. Dr. Weldon's presentation will be the Director of the Department of Communications has said that it is going to be able to be put online, complete with captioning and assistance to the hearing impaired. So we will be getting that out in the coming days. And I just want to, again, reiterate the thanks of all of the teams of persons who are continuing to work to make sure that we can be successful in battling this virus. Though Bermuda has not been spared, certainly the deaths of which we've seen and the number of cases which we've had, we've certainly been able to, with the tools at our disposal, been able to track, trace, and isolate, and certainly been able to test. And our capacities are getting better by each given day. So with that, I wish everyone a very good night. I sincerely hope that you tune into the House Assembly on Friday, and we look forward to seeing you back again here on Monday. One final note is that the Minister of Education will be doing a Facebook Live this weekend that is going to take place on Saturday evening, so you can look forward to hearing more about that, so you can ask your questions regarding education in Bermuda. Take care.